Good morning. Congratulations in being up this early in the morning on the last day of our meeting. I'm going to talk for the next 50 minutes about managing pediatric CT doses. I'd like to acknowledge a few people. Marilyn Goski is the director of Image Gently. I'm going to speak quite a bit about Image Gently this morning. I'd like to thank John Boone for some of the slides that I'm going to show, and along with these co-conspirators, we all worked together to generate Task Group 204, which was recently posted on the web about 2 months ago. And then finally, I'm going to use some slides that Mahesh and Don Fry originally provided. So I'm going to talk a little bit about the Image Gently campaign and how, what kind of resources it has available to help us in managing protocols for pediatrics. I want to talk a little bit about the public health concerns that we have with respect to pediatrics relative to adults. I want to talk about the shortcomings of our current dose indices in CT with respect to pediatrics. I'll talk about the effect of patient size on these indices. And that gets us to a clinical dilemma, but the good news is we now have an interim solution, and it's AAPM TG204. If you haven't seen that, that's posted on the AAPM website, and we'll talk quite a bit about that. And then I'll talk about some applications of SSDE, and we'll try and tie this all together with respect to managing pediatric CT patient doses. Well, Image Gently really is officially called the Alliance for Radiation Safety in Pediatric Imaging, and it's simply a coalition of healthcare organizations